Good morning, folks. It's morning on my side of the world. It might be evening on your side of the world. And welcome back. I'm feeling a little more chipper this morning. It's been a crazy run of things, and being so far away from everyone, sometimes I have sinking spells and don't feel really connected. So I hope that these Instagram lives are as meaningful for you as they are for me to connect with midwives around the globe as we explore what's happening in their communities and how they're doing to prepare for and actually manage the pandemic in their community with clients and actually the whole state of affairs that's shifting with maternity care providers. So I just want to say thanks so much for joining, and thanks so much for connecting. And remembering to take good care of yourselves. That's what I'm trying to do. Today we have the great pleasure of inviting an attorney and doula on the show. And she runs a practice in Missouri. So let's bring her in. Yeah, welcome. Let's see if we can make technology work. Hi, it worked. Hi.
How are you?
Good. I'm always surprised when I figure out the technology. I'm like, oh my gosh, it worked. Welcome.
Thank you.
How are you, my friend? You look good. How do you feel?
You're a little choppy.
Oh, really? I've got you completely. Can you hear me now?
It's pretty choppy.
Oh, bummer. Do you have good Wi-Fi?
I guess not.
Well, thanks for your patience. How are you? Where are you? Tell us where you are and who you are.
So I am Kimberly Lartey. I'm a certified doula in Kansas City. I'm also a midwifery student. Sorry. I'm in phase 3 right now as a midwifery student, but I serve as a doula alongside that. I serve predominantly Black women here in Kansas City. So my services are tailored toward that community.
I see. And you're also, you have a JD. Tell us about that.
I do. Actually, it was while I was in law school and was pregnant with my third child that I went through my doula training and realized that that's actually what I'd rather do with my life. So my legal background kind of colors the way I see birth work, but my primary passion is the birth work itself.
Yeah, that's so incredible. And I get chills thinking about what influence you're going to be able to have because of this focus that is unfortunately so uncommon in the legal world, is to have this clear focus. So my gosh, so exciting. And to be a midwife of color who's focusing on Black women in your community is just exceptional. So tell us, what's happening in your community as a result of the COVID virus?
So there are several things. As far as the community goes, there's differing feelings towards the virus. Some people are dismissive and others are high anxiety. And so as a birth worker, we have to balance both sides of that. And as a provider, we are communicating with the institutions that we're forced to work with, hospitals, clinics, and things. Our city right now is on essential business only. And so many people are having to forego prenatal appointments, or they're using telehealth to do prenatals. We are monitoring kind of how the hospitals are limiting access right now.
Yeah.
And so that's a big one. Everyone kind of has their ear to the ground and are contacting hospitals about who's allowed in. Has it changed?
Yeah.
Yesterday.
Yeah.
And then managing ourselves as far as what are the new protocols in place for COVID-19 as a provider, as a member of the community, and balancing all of those needs.
Are you getting an increased desire in your community, like we've heard in other communities, of people who are wanting to have out-of-hospital birth?
There is generally a move towards that, yes. It's difficult with my community. The access to home birth for women of color and Black women in Kansas City is pretty limited. We don't have a Black midwife in our community yet. There are several of us who are training right now, but we don't have a certified midwife yet. And so we're trying to educate the community on the options available to them. But it's a different climate. So yes, we are seeing that push, but our ability to provide options is limited.
And are the midwives that are in your community taking late transfers, or is that something that's not happening?
They are, yeah. As a whole, the midwives based in Kansas City have come together to say that they will accept late transfers and will work together to back each other up.
But it's just it's not culturally matched care. Yeah. Yeah. Okay. Well, so you have done a lot of births in the hospital. Tell us about what has shifted with that right now.
So the hospitals in our area are generally allowing one support person. And so doulas are having to switch to virtual doula work right now. Oftentimes, not always. Sometimes the pregnant person chooses the doula as their one support person. But if they choose someone else, then the doula should have in place a plan to be virtual or to support after the birth once the birthing person comes home.
I see. Well, this is so much change and it's so quickly. How is your spirit? How are you doing?
Oh, how am I doing?
Yeah. How is your spirit in all of this?
I am a determined fighter in general. So despite what challenges present themselves, I will overcome them. Now that does mean that I'm tired. Yeah. But I'm committed to serving my community in whatever way I can and making that accessible to them. So one of the things that I'm proud to be a part of is that there's a push to create platforms for virtual doulas, and one of those is through Milestones Midwifery, which is run by Cheryl Gates of KC Home Birth. She has a website where doulas who are volunteering to be virtual doulas can make themselves accessible to anyone in a hospital, really anywhere who needs support at the push of a button. And so that's virtualdoulas.org. And I'm interested in creating a similar platform that focuses on Black women and providing that culturally matched care that way.
Wow. That's really exciting. Well, definitely can't wait to hear what comes out of that. That will be incredibly helpful. I know that evidence-based birth also has created a database of midwife or doulas who are willing to do virtual support. So the mobilization there is just amazing. So I can't wait to see what happens. One of the things that I was really excited to see you posting about is the importance of having ID so that you can be considered essential services during this actual quarantine or shelter in place orders that are coming down. Will you tell us about like what you've done there, that research or that action?
Yeah, actually, so part of being, I feel, a responsible healthcare provider in this is just scouring all of the sources of information and coming up with a solid plan. And so in some of that research in various groups that I'm in on Facebook with birth workers from around the country, I actually saw that the protocol that was used, and I couldn't track the source down. I looked all day today and I couldn't find it. But they were saying for doulas to wear scrubs when you're traveling, to have a badge, and to carry your certifications with you. That way, if you're stopped because you're out when it's only essential business, that you can show either a police officer or whoever's asking, basically, that you are a healthcare provider of sorts. And for doulas, it was really important for AWON to make their statement that they said that doulas are an essential part of a birth team. And so they made their statement and published it in the size that would fit on the back of an ID badge. Awesome. And so I took that advice and took the opportunity to create a badge for the baobab tree, and encourage other organizations that have doulas to do that also. I also, within the midwifery community here in Missouri, I definitely brought it to their attention if they hadn't thought about it for their students who are traveling to births, to make sure that they have something that shows that they're a part of they're operating in a healthcare role, so that they can get where they need to go and serve their families.
That's awesome and such forethinking. Will you tell us what you put on the badge, or do you have any? Can you show us?
Yeah, let me see. There we go. So there it is.
Ooh, zoom in a little bit closer. I want to see.
It's the name of the organization.
Yeah.
Contact information, your role, and what you're certified with.
Yes. I love that.
And
it's really brilliant.
Go ahead.
It's really brilliant. I'm so excited that, someone is thinking through all the things. And then on the back, you printed that AWON statement. Yeah.
Yeah.
So brilliant. And did you find someone who could laminate it? Did you have one of those home laminators? How did you get through that?
Honestly, I sent it to Kinko's to do.
Awesome. And then you were able to pick it up. That's fantastic. I love that.
Yeah, I mean, you could make it at home, I guess, if you needed to.
Yeah. Yeah. No, it's very cool. I'm really impressed. And for the majority of midwives as well are self-employed, and we don't have badges. We work for ourselves in small practices. But the problem when we have these kinds of governmental policed lockdowns is, like, how do you prove your essential services? And I think this is such an important piece of information, what you've shared, so that midwives all around the country can prepare themselves to be essential services and walk through those lines with ID. Unfortunately, we do live in this very kind of police state at this moment, and we do need that kind of ID. I love what you've done. Thank you so much for sharing it. I'm going to share this video on YouTube when we get done so that people can really see it and share it. Do you expect that there's going to be any pushback from these IDs that are self-created?
There could be, but as the founder and director of my own organization, it's within my ability to create an ID badge for my employees, which you could consider myself that, because I provide services for my business.
Yeah.
I think it's a time to consider people formally structuring their programs that they might do if they haven't done that yet. The legitimization seems to come from if you have something overarching and higher than you as an individual. If I don't have a business that I can turn to and put on here with company name, address, phone number, than it is just me printing on a piece of paper my name.
Right.
So I can understand that. I still feel like lay midwives, I feel like doulas who don't have an official certification are still valuable members of a team, the birth team, and they're just as legitimate. They've predated the law that creates a legal entity that is a midwife or a doula. The practice of being with someone in labor, the practice of supporting our people goes back to the beginning of humanity. And I'm of the opinion that that shouldn't be regulated in the way that it currently is. But that's a whole nother conversation.
Boy, is it, my friend. Whew, we could go down that rabbit hole pretty deep. Well, can you give any, I mean, I know you can't really give legal advice, certainly, you know, that's a totally separate part of yourself, but could I ask your analytical, free-thinking legal brain to comment on suggestions for what someone might say if they were questioned carrying an ID like this? Like, what are some buzzwords that you are thinking to use to be able to be essential services?
I would say, without giving legal advice, go read the order that creates the stay-in-place, shelter-in-place order. Read it carefully. They give you language to use. They clearly define categories in those orders of people who are essential and who aren't. Just read it carefully, and because it's going to vary by place, it's going to vary by state and city. So just know what you're trying to work within, what constraints are you trying to work within, and put yourself in one of the boxes.
That's really helpful. Thank you for that. Well, as you think about all the doulas and healthcare workers and midwives around the country, do you have any advice for us? Do you have any suggestions, tips, techniques, anything that you want the midwives of the country to know?
Don't forget about the most vulnerable populations in all of this. I think that we have an inherent push and drive to protect our own, and when we feel like our rights, our fundamental human rights, are being violated or restricted in some way, we tend to rally around ourselves, and that's understandable. But just don't forget those who don't have the same ability to rally. Midwifery is universal. Labor, birth, motherhood, parenthood is universal. And COVID-19 and SARS-CoV-2 right now is pretty global and universal as well. And just remember those who are more vulnerable than yourselves. Remember those who could use a little extra support, and try to think from that universal perspective instead of such an in-group perspective.
It's so meaningful. That's such good advice. Thank you so much for your time and your wisdom today. I'm so grateful to connect with you on multiple levels, but especially today on this important topic. And I'm so grateful for your wisdom and your sharing and your ideas in all of this. I hope we can stay in touch.
Thanks for having me.
Yeah. Okay. Talk to you soon.